all. This is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So once again, we have Dr. Josh Helman with us. He is an amazing guest and has a lot of information for us. So today we're going to be talking about the 5 favorite supplements of his. And I have watched this talk of his before. That is why I requested for this one. So Josh, welcome.
Thanks so much, Dr. Bean. It's always a pleasure to be back on your show.
Absolutely. So starting with today's discussion, just a brief note for the viewers who may be watching for the first time. Tell us about yourself.
My background, I'm a medical doctor with 2 degrees in biochemistry, 2 degrees from Harvard, and I double board certified both in emergency medicine and lifestyle medicine. And my focus for the last 7+ years has been on reversing Alzheimer's. So
Excellent.
So I've got a very strong and deep background in both traditional medicine and also in more the functional integrative approach.
Understood. Thank you very much. And for the cool beans, once again, I have no commercial interest here. This is Dr. Josh. He is amazing. And if you go to drjosh.com, the link is in the description of this video as well. Then if you scroll down to the bottom, you can actually find the remaining channels of his YouTube channel, his LinkedIn, his Instagram, email, and Facebook, etc. So here is his site. I would recommend that you visit that as well. So back to Josh. So I have heard this talk before and I am intrigued by it. And I'm so honored that it's going to be for our audience as well. So tell me your first favorite supplement and why is it your favorite?
Yeah, so my first favorite supplement is actually nitric oxide. Nitric oxide is a gas. It's just one nitrogen and one oxygen atom stuck together. And what nitric oxide can do is open up blood vessels. So we're as healthy as the health of our own blood vessels. So where in the world do you get nitric oxide from? Where do you get this gas from? It turns out if you chew leafy greens and beets, you get nitric oxide, and you can do that. You actually, half of the nitric oxide is produced in the mouth, half in the gut. So you really want to chew your leafy greens and beets. So I definitely recommend you all go do that. In addition to that, what I do is I take a nitric oxide supplement called Cardio Miracle, which is a powder. You just mix it in water, but then you also swish it in your mouth because you want to maximize that nitric oxide production. And the reason I do that is when you chew on leafy greens or beets, that only lasts for about 2 hours boost of nitric oxide, as opposed to this supplement is designed to last 24 to 36 hours of nitric oxide production. So that's why, in addition to the leafy greens, I recommend Cardio Miracle or a nitric oxide supplement like that.
Understood. And there are some supplements that are related to nitric oxide, for example, L-arginine or others. Is it good to have nitric oxide or the precursors to that as well?
Actually, it's both. So if you look in the ingredients of Cardio Miracle, there are over 50 ingredients. One of them happens to be L-arginine. And you're right, L-arginine is a precursor to nitric oxide. I also, this sounds really weird, but I've used clinically intravenous L-arginine to open up blood vessels for people. So that's part of the functional approach. But yeah, I'm definitely a fan of L-arginine.
I had never actually heard of, and that is just my ignorance, of L-arginine intravenous to open up the blood vessels. Of course, nitric oxide works on the smooth muscles of the blood vessels and dilates them. So that is an interesting one. I knew that we can have that for angina under the, very good.
So just to be clear, this is me using it with my training in biochemistry and understanding the pathways and having it available to me in a clinic where I could give it intravenously. But I'll also tell you, I've had patients in active, coronary chest pain, so fast heart rate, where I gave them, a glass of Cardio Miracle, and they took it, and then within a minute, their fast heart rate went away. So
that is amazing.
Yeah. So it is so cool to have a tool like this
Hmm.
Yeah,
So I have a related question, and my own age. I'm 56 now. The question is, people who are, due to their age, are at risk of cardiovascular issues. Do you think it should become, and again, no medical advice here, it's just me asking you from
sure.
education point of view. Do you think it is actually interesting for folks who are 50 plus, for example, to always have nitric oxide as part of their routine?
Yes, I believe so. So here's one interesting thing is as we get older, starting at the age of 25, when we look at people's nitric oxide level in their blood vessels, it goes down and down and down with aging. So to my mind, as an anti-aging measure, it makes sense to supplement the nitric oxide, bring the levels back up. So yeah, so for virtually everyone, I normally recommend supplementing nitric oxide and eating their leafy greens. I mean, that's amazing.
And so, are there any group of people who should not take nitric oxide?
Well, so first of all, it's a natural substance. Um, I would say if you've got someone under the age of 25 who's healthy, happy, I don't really see. But I've actually seen competitive athletes, professional athletes in their early 20s take it. Um,
Understood.
so
Understood.
um, no, I can't. I can't think of a reason. So here's a
Mm,
reason. If you're allergic to beets, don't chew on beets. If you're allergic to leafy greens, don't chew on them.
mm,
But apart from an allergy, what's
mm.
interesting is when you give someone Cardio Miracle, they may get flushed. They might get like a niacin flush after the first 30 seconds. That's not really an allergy. It just shows that it's actually working, opening up blood vessels.
Awesome. Thank you very much for this one. So nitric oxide is one. What is your next favorite supplement?
Yeah, so my next one is called NMN, which stands for nicotinamide mononucleotide. And that turns out to be a precursor to NAD. And NAD, I know this is an alphabet soup, but NAD is a cofactor responsible for hundreds of different reactions in mitochondria related to not just energy, but also turning back your biologic clock. And just like nitric oxide levels go down, 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 down as you get older, similarly, we see lower and lower levels of NAD. And by bringing up the NAD levels with NMN, I've seen good results.
I can actually totally understand. Just to add my 2 cents in here as well, for the mitochondria to start making ATP, the two molecules that bring energy from your food to the mitochondria to then make ATP are NAD and FADH2. So what happens is our body loads the energy extracted from the food that we eat onto the NAD and FADH2. Then these two guys go in the mitochondria, deliver that energy electrons to mitochondria, which then converts those or makes ATP from them. So this is an important part of mitochondrial health and our energy health. So very good supplement. Again, I'll ask the same structure. Who should, number one, have this? Everybody 50 plus, 40 plus, or some specific pathogenesis, and if there are any contraindications that you are aware of?
Yeah, so in terms of who should be on it, I think if you're over the age of 25, I would look to supplement with NMN because we're talking about turning back your biologic clock and optimizing energy. The only contraindication I can think to NMN would be someone with cancer, active cancer. I would be afraid that not only are you giving NMN to the non-cancer cells, you're also giving it to the cancer cells. So for that reason, if you have cancer and you're under the care of an oncologist, ask them. But
Mm,
for everyone else over the age of 25, I would recommend it in general.
understood. Thank you very much. So then, I love these two. So what is the third one?
Okay, so the third one, I have a bottle right here. It's called Pectol, and it's kind of screen. Here we go, Pectol. Um, It's modified citrus pectin. And the reason I like it is a binder, but the reason that I like it is, number one, it's been studied for over 20 years. Number two, it's been shown to remove toxins, heavy metals, and mold toxins, which unfortunately I'm seeing in more and more of my patients. Number three, it is an inhibitor of something called a protein called galectin-3, which is a lectin. Many of your viewers and listeners have heard that lectins cause inflammation. They do. And there could be lectins in plants, but it turns out that we humans make our own lectin. One of them is called galectin-3. And what we're finding is increased levels of galectin-3 in many different chronic diseases. So what I love about Pectol is that it actually binds to galectin-3. So that's So
Amazing.
Pectol.
So
I would recommend Pectol. Yeah.
understood. And considering that I've requested you for your top five, Pectosol being in one of them is actually a big deal. So my question, once again, same thing, is who should take it and who should not take it?
Yeah. So I would recommend Pectol again for anyone over the age of 25. Um, I can't think of any contraindications except because this is a binder. You don't want to take it at the same time that you take other supplements or food for that matter. It won't hurt you, but what's going to happen, because it will bind to whatever supplement. So let's say you decide to take NMN with Pectol. Basically, the binder is going to bind the NMN, and it's as if you took nothing. So that would be my only caution, is that you want to wait an hour before taking the Pectol.
That's a very interesting tip. Thank you very much. And so, three down, what is your fourth favorite supplement?
Yeah, so my fourth one here, got a bottle here, is called Hono Pure. And the other name for it is Hinokiol. And what it is it's an extract from magnolia bark. And I like it because it's anti-cancer, it decreases inflammation, and it's also protective of the brain. Many of my patients are trying to reverse dementia, Alzheimer's, other conditions. I find that it's a fatty compound that will go through lipid bilayers and go into the brain and other fatty tissues. So
Interesting.
yeah.
And is it good for everyone, or is there some selectivity?
Yeah, so it helps with stress. It helps support the brain. I like it. I think for everyone, again, over the age of 25, it helps with sleep. I think you can make an argument if you're out there healthy, happy, no cares whatsoever.
You don't need anything.
I would, yeah, you probably don't need anything, but guess what? Even if you're healthy and happy, I don't want you aging prematurely. So,
Correct.
I'm a big fan of Hono Pure.
And many times when we are actually healthy and happy, for example, I give my example so that I don't project it on somebody else. So, for example, I feel happy and healthy, but who knows what subclinical inflammations have started and chipping away at the cells, and I would see the results in another months, years or so. So if I take care of my body now, I would delay that process of the damage that would occur. So just being happy and healthy isn't totally a clean card as well to say, okay, you don't need to take care of yourself, correct?
Well, what's amazing, I agree. What's amazing is you may feel really good now, but the thing is, if I can get you feeling even better, even you may not even know. So, I think it's
Understood.
worth a try. Yeah.
Makes sense. And a very quick question before we go to your next one. So Jean says, have you found benefit for Pectosol for COVID based on galectin-3 connection?
So the answer to that is yes. I have found benefit with people with long COVID type syndrome, spike proteinopathies. I've definitely found Pectol helpful as a binding agent that specifically will lower the amount of this lectin, galectin-3, which will lower inflammation. And when it does that, it will stop amyloid from forming in the brain and also decrease inflammation in other parts of the body too.
Understood. Thank you very much for this one. Now, the last one. What is your fifth favorite supplement?
Yeah. So my fifth one is lion's mane. I'm a huge fan of the mushroom called lion's mane, and I recommend it certainly for all my patients with Alzheimer's or other dementias. There have even been clinical studies showing at a dose of 1,000 milligrams a day that mild Alzheimer's or mild cognitive impairment was able to be improved. So,
Very
yeah.
interesting. So, before I ask you some more questions on lion's mane, for the audience, on my channel, there is a video where I discuss the mechanism of action of lion's mane. So you can just search in my channel and you can see this. So very good. For the lion's mane as well. Um, Contraindications and indication, is it for everyone or is it for a specific group of people?
The contraindications, obviously, if you're allergic to lion, I haven't seen many allergies. And then if you are on a blood thinner, I would be careful. But those are really the two areas that I've seen.
Understood. So, any bonus supplement?
Sure. So actually, for lion's mane, the one I take is called Roar lion's mane, ROAR. And then for a bonus supplement, I would strongly recommend people take an omega-3. This one here is Nordic Naturals, but I recommend omega-3s. I find most people in our society, Western society, have way too much omega-6, which is inflammatory and aging, and not enough omega-3. And I like the Nordic Naturals algae because number one, it doesn't have heavy metals or other pesticides or fatty toxins in it. And number two, it's been tested not to be oxidized. The last thing you want to do is take an oxidized fish oil, omega-3 fish oil, which actually, because it's oxidized, is pro-inflammatory, is actually hurting you potentially.
Absolutely.
So yeah.
And I'm so glad that you brought up omega-3. I think omega-3 for everyone should be, unless they have some specific contraindications to it, it should be part of their life because we have so much omega-6 in our cell membranes that any small trigger for inflammation, and here we got an intense inflammation, omega-3 tries to counterbalance that. And this is also so interesting that you're saying, hey, don't take oxidized. This is why the omega-3 bottles are kind of dark, so that the light does not fall on them and oxidize them or help create those reactions. The interesting thing for you viewers, if you have oxidized or peroxidated lipids, which omega-3 has EPA and DHA, which are the polyunsaturated fatty acids, which can become oxidized more easily. And once they become oxidized, they would then create a cascade of reactions and cause other lipids to become oxidized as well. Then they would create the DMA and they would create NHE, and the DMA itself is going to go and start welding other proteins with DNA and other things, and it just creates havoc. So,
right. And because we're talking about DHA, EPA, DPA, they have all these double bonds that are very vulnerable to getting oxidized. So another important tip is refrigerate. Even if the omega-3s are not, if you don't purchase it in the store refrigerated, store it in a refrigerator, because the lower the temperature, the harder it is for those double bonds to get oxidized.
that is a beautiful tip. And also one more tip, and that is that most of the time omega-3s, when you buy those supplements, they accompany tocopherols or antioxidants with them. So make sure that they have tocopherols in them. If not, then you'll have to kind of supplement antioxidant with omega-3. So
Agreed.
Josh, this is amazing. Here is a quick question. Jim says, don't forget extra virgin olive oil.
Yeah, I think extra virgin olive oil is amazing if you have a painful joint. But I normally do not recommend taking olive oil or any other oils orally. I mean, apart from the omega-3s we just talked about, because what the studies are showing is after let's say you eat a meal with olive oil, you get something called sludge blood. So if I were to pull blood out of your arm right after you eat a meal with olive oil, the fatty olive oil will layer out on top, and then if I look under a microscope, I will see that your red blood cells are stacked together, something called rouleau, that go along with inflammation. So, I mean, just to be clear, I've had companies, olive oil companies, wanting to sponsor my weekly podcast, etc. And I had to say no, because I recommend that people don't take olive oil orally. And I understand this is different than what you're hearing. But my concern is the science is pretty clear that when you eat lots of oil, unfortunately, you're doing damage to your blood vessels. And unfortunately, I think that those experiments and that science is being ignored. Instead, it's being promoted as a $1 billion food part of the food industry. So that's my opinion on olive oil.
Understood. Thank you so much. And so before we close, I want to once again share your site. So this is drjosh.com. That is where to find Dr. Josh. His link is present in the description of this video as well. This is Josh's YouTube channel, Dr. Josh Helman, MD, or Green Brains MD. And my own little plug, this is drbeen.com. If you would like to have more medical lectures, please go there. And with that, thank you.
Before we run, if you want a copy not just of my top 5 supplements, but if you want my top 7, you can just go to drjosh.com/program, and there's a link to my top 7 supplements for Alzheimer's /program.
Perfect. So here these are.
Yeah.
You look like you were already ready for this talk. Awesome.
I'm always ready.
Awesome. That is great. That is great. So with this, Cool Beans, thank you very much for watching. And Josh, thank you so much for coming in and sharing your favorite supplements with us.
It's always a pleasure. Thanks, Dr. Bean.
Thank you very much. Bye for now.
Peace and plants.